This segment of Delmarva Life is brought to you by TidalHealth.
Do me a favor. Think about that person. Think about those people. It might even be you living with diabetes. As if managing the disease itself wasn't enough, consider this. Studies show a strong connection between diabetes and heart disease. So on this last Tuesday of Heart Month, how about we tackle this topic in an effort to save lives? With us this afternoon to talk about it is Susan Cotton. Jim, she is the Diabetes Education Coordinator at TidalHealth Peninsula Regional. How are you, Susan?
I'm doing good. How are you?
I'm good. Thanks for talking to us. So help us understand the connection between diabetes and heart disease.
Diabetes is an independent risk factor for heart disease, meaning that's one on its own, it can play a role in the development of heart disease. So that's critical because one of the leading causes or the leading cause of death for people with diabetes is heart disease. So there is a very strong correlation. And it's important to recognize that once a person has been diagnosed with diabetes.
Boy, that is a really big word you use when you say critical. Is it something that can be handled as simply as a healthier lifestyle?
Definitely plays a role. I think it probably depends on where the person is at in their stage of diabetes. Are they newly diagnosed? How long have they been diagnosed? What about the heart disease? Have they been diagnosed with heart disease as well? And there are many things that are shared by both diseases. For instance, having a high cholesterol is a risk factor for heart disease and diabetes, being overweight, lack of activity, stress. So both those diseases share similar risk factors. So if you get many of those under control, and you can do that with lifestyle, or sometimes you may need help with medication. If you can get those under control, then that's going to help minimize your risk of the poor diabetes control, and then the risk of developing heart disease.
So with everything that's going on right now with COVID-19, you're conducting a lot of telehealth appointments, and it's pretty darn important for your patients to stay connected, I'm sure, in whatever way they can with their provider. Is that right?
Yes, it is. And with COVID, we did switch to telehealth, and that went very well. We moved our diabetes education classes over to using telehealth, and it's worked out well. Many people like that aspect because you don't have to get in your car and drive, but you can take the class in your home or wherever you have your access to your laptop or computer or your phone. And we are starting to move back to some in-person visits and small in-person group classes, but you don't want to let diabetes get out of control. And, it doesn't have to with the restrictions that are placed on COVID. We still have services available that you can take advantage. So you can learn about diabetes in a group. And we also have individual appointments to learn about medical nutrition therapy, to learn about how to eat, to manage diabetes. And both of those are very critical. And that's my word today, critical. But it is because you want to reduce your risk of heart disease. And doing that by managing your diabetes is an excellent thing for this month.
So you've got other heart health programs in TidalHealth as well that will help people living with diabetes.
Yes, we have individual nutrition appointments, so that would be with the dietitian. And then we do the individual diabetes education classes. So that's a 4-week group experience, and you learn about different aspects of diabetes. We cover a lot of things in terms of monitoring the blood sugar, just dealing with the emotions of diabetes, because it is a chronic disease. And once you have it, it's not going away. You have to learn how to manage it. And there, again, shares a similar thing with the heart disease. So just, all the things that people go through, it's not like you can change it and voila, it's fixed. You have to stay on top of it every day. And that's what's hard about diabetes as well as heart disease. So those classes can really help. You also meet other people that are experiencing the same things. So it can give you, some common ground to know that you're not out there alone. We are doing some support groups. That has changed a little bit with COVID, but we have done some virtual events, and we're planning to do another one of those in April to focus on, managing diabetes, which again is going to help decrease the risk of heart disease.
I look forward to talking to you again then. Susan Cotton, Jim, who's the TidalHealth Diabetes Education Coordinator. Thank you so much for talking to us this afternoon.
Welcome. Thank you for having me today.